And now here's your host, Deborah Duncan.
Thank you very much, and welcome to Great Day Houston. Okay, so a couple of you stood up when they announced my name. I have a prize for you after the show. No. All right. Well, in the world of health, the cost of prescription medications has been an issue for quite some time. Last week, people who depend on the drug Daraprim got a shock when they showed up to fill a prescription. That's because the company that owns the rights to the drug, Turning Pharmaceuticals, changed the price. It went from $13.50 to $750 overnight. The drug is used to treat malaria and another infection caused by parasites. There are several companies with outrageous pill prices, so here's the question. Should there be price controls on life-saving medications in particular, or is this just the free enterprise system at work? It's time to find out in Medical Hot Topics. And on our panel today, please welcome cardiologist Dr. Mohamed Shalaby, gastroenterologist Dr. Ryan Barrientos, and OBGYN Dr. Cor Law. Good morning. All right, so this is the tough part. It kind of falls under that banner of whether healthcare is a privilege or healthcare is a right. When it comes to the medications, we go see our doctor, we go, oh, here's the problem, and this is what's going to help take care of it, and then you stand there at the pharmacy. I remember in college once, I had $100 for the rest of the month, and I had strep throat, and I'm standing in front of the pharmacist, and she goes, that's going to be $110. And I'm like, I'm $10 in the hole, right? I thought, what am I going to do? I started crying. But a lot of people are faced with that, especially when you're dealing with price hikes like this.
I'm very happy that this issue came to be the focus of media. This is because this is a struggle that we deal with every day, not with only this medication or medication that's very specialized, but with general medication as well that we consider life-saving as blood thinners and blood pressure medications and all that. And the price is a lot of times out of proportion of what the cost of the medicine is or what the patient would pay if he gets the medicine from anywhere else from the same company, let's say from India or Canada or Mexico. So I wouldn't say that we have to control, but the society have to kind of judge what is a good profit, because we want the pharmaceutical companies still to make a profit because they do all this research.
Yeah, it is business. They have to make a profit.
And they help us a lot, but we want to kind of interfere to make sure that they make adequate profit, but not too much as we saw in this
Dr.
case.
Law, you have a case where kind of the doctors rose up with patients and said, we can't do this.
About 4 years ago, one of our medications that we used to use from compounding pharmacies called progesterone, we used to give that injections weekly to women who have had a previous preterm labor. And another company started making this medication called McKenna. And overnight, they took that medication, and what we could get from compounding pharmacies from $10 to $40. The McKenna medication was about $1,000 an injection.
Wow, just a price increase just like that.
Like that. And they sent letters to the compounding pharmacy saying that you can't make this anymore.
Oh.
So the doctors...
so they cut off their competition.
Yeah, they tried to, but the doctors... they realized this is not any better, or the compounding pharmacies were just as good. So they rose against that, and shortly after that, the company that made McKenna filed for bankruptcy.
Yeah.
You know, this situation is very unfortunate because what's most important is that patients have to realize the cost of these medications, that's not what they're going to be charged. And for a patient to avoid getting treated for something important, like let's say in my field, hepatitis C, unfortunately the drugs have received very negative press because the cost is $80,000 sometimes.
Wow.
The patient's not going to be charged that. And when the medication provides a cure, sometimes at rates of 96 to 100% in some situations, that is, you know, it poses the question, what is the value of your life and your health?
Yeah, and you're right about that. I mean, sometimes people complain about the cost of something, but you got to look at what are you getting out of it. But if you just don't have it, or in this case, if the increase is not because a company needs to make a profit, they're trying to make up for the X millions of dollars that they just spent on something, and it really is a let me get all the money I can in. And so it's a delicate balance. Now, what has happened over the years is a lot of people have decided, well, I'll just get my medication cheaper online, or I'll get it from another country. But we got to be careful with that.
Yep.
Absolutely. The FDA is there for your protection. They regulate the quality of these medications, and you may not get that going across the borders or even to another continent for a less expensive drug.
Also with that, I'm sorry.
I always advise my patient, if you find that the price of the medicine is so expensive, go back to your doctor and say that there's an alternative for this medicine. There is always tons of other alternatives, and maybe this is his preference, and might be your insurance plan or this particular pharmacy. So do a little bit of search before you commit yourself to the price.
Yeah, because there's actually discounts that you can find. There's coupons online.
Well, there are other medications that work just as well. We just don't know all the time which one is on your insurance plan or not. And if you come back to us, we can pick a different one
Yeah,
for
so
you.
do a little work. And I asked my pharmacist once, and he goes, okay, this medication, something I got was $150. It was like a steroid eye drop. And then he came back and goes, well, looking online here, there's some coupons, so you don't owe me nothing. I'm like, I went from 150 right in a matter of 2 minutes to owing nothing. So, yeah, do your due diligence on that. All right, lower blood pressure guidelines. There was a major new study that was canceled that found that blood pressure can go much lower than current guidelines. This is one of those things, again, that we oftentimes have these numbers. For certain numbers we should be within, and we're like, okay, what's really right for what person?
Very good. And that's where we come back in and saying that medicine is not one size fits all. Medicine have to be tailored for every individual. Now, the consensus between all of us in the cardiovascular field or on the medical field that we really want blood pressure to be low as we can, as long as the patient does not suffer the consequences of it. So if I can get my patients to be below 120 all the time, I'm very happy with that. Now, the patient have to be educated how they monitor the symptom that happen if their blood pressure is too low for them. And part of that is tired, fatigue, feeling dizzy, especially when you change your position, you get up all of a sudden, then you feel that you're staggering a little bit. So if I can get my patients around 120 or below without having any of these symptoms, then I'm very happy. I'm very careful with older population because their tendency to get low blood pressure, then the falls and the bad consequences.
Yes.
So I always advise them to keep a blood pressure monitor at home that would check the accuracy of it in our office, comparing it to the regular ones. And I educate them very well. How do you feel if the blood pressure is low and what do you do about it?
Yeah, because we always focus on high. Like, just like we always focus on being too fat. We don't ever focus on being too skinny. Which is not a fear in my life. But anyway, okay.
Those guidelines are important even to like specialists like us because in today's world, in today's the population, people are seeking out specialists on their own, right? They're taking the initiative. I need my colonoscopy. Let me go see Dr. Barrientos. And they show up without any primary care physician referring them. And so I see these skyrocketing blood pressures. I need to send it to my colleague, Dr. Shalaby here. So.
Yeah, but there's a reason to go to those primary care doctors to get kind of the baseline, if you will. And then if you need that specialist, that's when you go. All right, there's a study that says that misdiagnosis is a major issue. Most people will get at least one wrong or delayed misdiagnosis in their lives. And I think sometimes people think that, that doctors are all perfect and you nail it all at the first time. But that is the point of getting first and second and third opinions, and also being a partner in your health. When you feel something's wrong, then you got to have that dialogue and that conversation with that doctor to help you, because you're kind of like detectives in a way sometimes.
Well, it's important to, if you don't think that sounds right, you get another opinion. I mean, there are different ways to do things. And you know what? It's not easy. I mean, we don't always get it right the first time, I mean, so...
And a big part of why we get into misdiagnosis to start with is over-ordering of diagnostic testing, meaning that the classic story is someone came from a church Sunday afternoon and they are dizzy. Right? They're dehydrated, they got a little emotional, it's hot over there in the gathering, they get an MRI, they get a CT. They get a whole tons of testing that they might not have needed it. Then some of this will become abnormal, then we follow the trail from there, that there is a mass, there is an aneurysm, there is abnormal lab test, and from there we start building based on it, even though the clinical story did not fit from the beginning. It was just dehydration, for example. So that leads to more testing and more wrong diagnosis, and that causes a lot of cost, a lot of discomfort and anxiety for the patient and his family as well.
All right. Okay. Well, thank you all very much.